I'm delighted to welcome everybody who's here in the room and the folks who are joining us on Zoom. It's been such a great ride having these match day celebrations where we're able to welcome new residents, celebrate residents and medical students and pre-medical students, and thank the many, many people who help us make these education programs possible. That's me. Most of you know our mission already. Our mission is to provide accessible, affordable, quality primary care in an atmosphere of dignity and respect, where the health and well-being of patients and community are promoted through direct services, outreach, and advocacy. And that really speaks to what we do here at North Country. We offer more than primary care services. We offer dental services, behavioral health, clinical pharmacy services. I could go on and on. And we do it in an integrated care model. So that means that the folks who train with us don't train in isolation as family medicine residents or dental residents or pharmacy residents. They actually learn together, which allows them to have a better experience and be better able to take care of patients in the future. These are the communities we serve. And you can see we cover a wide area here in northern Arizona, all the way from the New Mexico border to the California-Nevada border, as far north as the Grand Canyon, and as far south as Payson. I'm not gonna say if Payson's maybe a little farther north than Round Valley. It probably is. But why do we do what we do for our residency training programs? This data comes from a study that was done by the American Association of Teaching Health Centers and looks at folks who've trained in primary care and who've trained at a teaching health center versus traditional graduate medical education. So most folks who train to become physicians, I fall into this group, train at a university hospital in a large system, and that's very different from training based in community at a place like North Country. So more folks who train at a place like North Country go into primary care than in a traditional university-based system. More people who train at a teaching health center are likely to go to underserved areas versus traditional GME. And we also know that folks who train here are more likely to serve rural communities than in the traditional environment. And also, as a community health center, I like to say that more of them come and work in FQHCs. We're a very different way of delivering care than traditional private practice or traditional academic medicine. I want to give special thanks to the NARBA Institute. The NARBA Institute has been a thought partner with North Country as we developed this community-based family medicine residency program, and as we work toward a community-based psychiatry residency program. Their $3 million multi-year grant is what helped us launch the NARBA Institute Family and Community Medicine Residency Program. And I don't know that we would have had enough wind in our sails without their thoughts and their cash. They've also supplied a $50,000 grant that helped us do the feasibility study for our psychiatry residency program, and that was instrumental in helping us secure teaching health center planning and development grant. So it gave us all the data we needed to really flesh out that application. I'd like to recognize some of our training partners. We work very closely with Banner Children's at Desert so that our family medicine residents get a high volume of inpatient pediatrics. We work with the Coconino County Health and Human Services Department, Flagstaff Medical Center, Tuba City Regional, Kingman Regional, and the NAU Center for Health Equity Research. These are all critical partners to help us train our family medicine residents and our clinical pharmacy residents. We have a number of other stakeholders listed here are folks who are on our graduate medical education committee. So these are academicians and leaders across Arizona, some here in Flagstaff, some in the southern part of the state, and some up in the north in training sites like Tuba City, as well as our own staff. It includes residents, our residency program director, our psychiatry program director, Kurt Mueller, as well as myself and Maritza Martina. So next I will hand things over to Dr. Sarah Coles to tell us about our new family medicine residents.
Hi, good afternoon, everybody, and thank you so much for coming to celebrate our family medicine match. I'm absolutely thrilled to get to share with you our amazing new residents who will be joining us in July. I'm Sarah Coles. I'm the Family and Community Medicine Residency Program Director, and this is such a wonderful day to get to celebrate all of the work that we all get to do together to train our family medicine residents and to see our mission forward. So just to recap a little bit, our purpose in the family medicine residency is to help address the dire need for primary care physicians, especially in rural communities that we know is present, particularly in northern Arizona. And North Country, as Dr. Newell mentioned, is perfectly positioned to meet this goal. We can build on our long history of education and leverage our well-established collaborative partnerships and relationships with many health partners across the region and across the state of Arizona. And this allows us to expand access to care for all of those who need it most in our communities. This year in our recruitment season, and for those of you who don't know, our residency recruitment is wild. It's a wild ride every year. We had over 400 applicants screened through the electronic residency application service. So over 400 people applying for 4 spots in our residency. We conducted 56 interviews between October and January, the majority of whom have some ties to Arizona. We really wanted to prioritize folks who would serve in northern Arizona and our community. And we successfully filled with 4 incredible candidates who will start with us on July 2024. So first, let me introduce to you Dr. Marley Dunn from the Arizona College of Osteopathic Medicine at Midwestern University. She is particularly interested in longitudinal care and building continuity relationships with her patients. She has volunteered for over 5 years with Feed My Starving Children and has really demonstrated a commitment to underserved and community-based care. Dr. Cambria Lacasse, who is one of our own from A.T. Still University of Health Sciences School of Osteopathic Medicine in Arizona in the Flagstaff cohort. Cheers to you, ATSU. Is particularly interested in serving diverse and vulnerable populations. She has really stood out with us. She's done a number of rotations and research projects with us, so we're thrilled that she'll be joining and staying here in the Flagstaff community. Dr. Octavio Oliva, also from A.T. Still University, here in the Flagstaff cohort. Tavo has been a part of the North Country healthcare team since I think the very beginning of his health professions journey, and worked here for 7 years as an interpreter prior to going to medical school. He is particularly interested in patient advocacy and promoting health equity, and is just, we're so thrilled that we get to keep Tavo with us. And last but not least, Dr. Anthony Paolucci from Northeast Ohio Medical University. Shout out to Tony, who I think is on the Zoom. So we're thrilled to have you, Tony. He is also particularly interested in bridging healthcare gaps in underserved communities, and he's demonstrated this throughout his medical school career with lots of volunteerism in free student-run clinics, and it's going to be just a wonderful, wonderful addition to our program. We could not be more excited to have these 4 individuals join us, and we know that they're going to add so much joy and spirit and brilliance and enthusiasm and commitment and care and dedication. So truly, truly grateful and cannot wait to meet them in person in July. And with that, I'm going to hand it over to Kimberly Chen.
Good afternoon, everyone. So I'm Kimberly Chen. I'm the Pharmacy Residency Program Director. And our information is going to look a little different than medical residency because pharmacy residency looks a little different than medical residency. But we were accredited 11 years ago, and our standards have changed recently. I share our statistics at the bottom because I think it helps give you context. They had 500 or 400 applicants. We had like 20 applicants. So the pool gets much smaller, and part of that is because pharmacy residency is not required to enter the practice of pharmacy. So pharmacy resident candidates are wanting to pursue intensive training in clinical program development, teaching, and research. And so last year, there were a lot of candidates, not a lot of residencies. So it's a pretty competitive arena. Oops. And so the reason we're going on through the slide that I previewed is because this year, during the phase 1 of the match, our program did not match with any candidates. That's actually not unusual. I think this is maybe the 3rd or 4th year that that's happened with North Country. And again, mostly it's because of the competitive nature. Many candidates originally look at their search and they often look very geographically, limit themselves in programs, or come into the residency search not being enough educated as to how to seek for programs that meet their need. Being a federally qualified healthcare program, we're one of less than 200 programs that trains the way we do. And of those 200, there's less than 100 of us that are actually FQHCs. And so candidates have a hard time finding our types of programs. And we actually took some efforts this year to increase that visibility, but it'll take a few years for it to catch on. So we're actually in the middle of phase 2 match, which is different than medical residency because there are so many programs that don't match in the first round. There's a second round. And then after that, it becomes like medical where there's sort of a scramble or a so where you then just try to match with any candidate. So more to come on our program and where we might land, but we have no faces to show with you. And now I'm gonna change hats, and I know I don't look like Bruce, but my future slides will explain why I'm presenting on behalf of Bruce, our dental director, who also oversees our dental residency. So our dental residency is through NYU Langone, and it's an AEGD residency. It's a nationwide program, but the accreditation is held under NYU. And the residents actually are employees of the NYU, even though they work here and serve our patients. This year for the match, we actually did not seek PGY1 candidates. I know some of you are looking very confused, and that's okay. Our current resident candidates asked to do a second-year residency in dental. Similar to pharmacy, dental residency is not required at all, but residency candidates can do 1 or 2 years of residency. And our current candidates who are our current residents are phenomenal residents, wanted to stay with us for another year. And so we requested the ability to have a PGY2 this coming year through NYU Langone. And so we originally had 6 applicants pursuing us for a PGY1, and we let them know that we wouldn't be matching this year because we wanted to keep our PGY2 residents. And so this program is new to us again. We used to have this residency and then had a period of time where we just didn't have capacity. So we restarted this residency in 2023. And the reason Bruce is not here today is today, as we speak, we are having a site visit for our residency. And so folks from New York are across the street in our building, looking at our residency program to make sure we're meeting all of our standards, which is why I am here being Bruce at this moment. And so we do have our 2 positions for next year filled with our current candidates. So we have Claudia, I always say this wrong, Coelho, and she is from the Dominican Republic and has many interests that align with how to practice dentistry. So we're very excited to have her back with our patients. And honestly, our patients are very pleased to be able to extend their care under her for another year. And then our other resident that will be a PGY2 next year is Ivan Viego. I think I said that correctly or close. And he also comes from the Dominican Republic and has quite a passion for dentistry. So we are super excited to have these residents extend their training with us. And then we would anticipate in next year's match that we would go back to having PGY1 residents and going back and entering into the match again. So we are so excited to share all these results of all of our programs with one another. And I'm going to turn it back over to Dr. Newland to continue on with our presentation.
Thank you, Kim. So just a big welcome to all of our new and continuing residents. We're delighted to have you. So next, I'm delighted to say that we're going to share the Brandon Abbott Scholarship to Medical Education, Mentorship, and Beyond. I always feel like I should do that in a more buzz-like way. But this generous donation from Brandon and his family allows us to give $1,000 to 3 outstanding candidates who are pursuing careers in medicine. And the dollars can be used for whatever they need. Is it for tuition assistance or loan payoff? It can help offset living expenses, all sorts of things. And it's a way to sustain mentorship of these trainees. So first, we'd like to recognize our pre-medical student, Beyonce Bahi. So Beyonce, come on up. senior pre-med student. Come on up.
Okay.
Yeah, she's a pre-med student at NAU, and she grew up in the rural area of the White Mountain Apache Tribal Reservation. So she knows the challenges firsthand faced by Native American communities in accessing primary care. She's committed to addressing healthcare disparities, and she wants to mentor the younger generation. There's not a lot of Indigenous physicians, and I think having a physician who can relate directly to your experience is just incredibly important. So she's got the cultural understanding and the dedication that's going to position her as a future leader in primary care, and she's going to help create equitable access to healthcare for everyone. So, congratulations. And next, we'll go on to Jason Yamashita. Jason, come on up. Is also committed to serving vulnerable communities. As an undergraduate, he volunteered on Skid Row in Los Angeles, where he witnessed the harsh realities of life for people experiencing homelessness. He's currently a National Health Service Corps scholar with ATSU and plans to work at an FQHC down the line. He's a dedicated advocate for comprehensive health care and will make a lasting impact in primary care. So congratulations. And next, I'd like to welcome Dr. Jeff Quick. See you. Okay, so Jeff is a third-year North Country Healthcare Family Medicine resident, and he's just at the end of his residency training. He's worked in diverse medical settings, from hospitals to psychiatric facilities. Dr. Quick found his true calling in family medicine, though. He values a holistic approach to patient care, focusing on individuals rather than isolated medical conditions. And after graduation, I am delighted to say, Dr. Quick is going to come work for North Country. Physicians serving our patients in Williams and the Grand Canyon. So Jeff, many congratulations. So thank you all very much. That concludes the formal part of the presentation, but please take time to enjoy each other's company, and then we're going to grab some pictures. There's also cake.
Yeah. Maybe fruit.